I'm Jim Green. I'm President of the International Niemann-Pick Disease Alliance, and my involvement began 23 years ago when my children were diagnosed with Niemann-Pick type C disease.
Niemann-Pick type C has had a profound effect on my life. I am a mum of 3 children who were affected by the disease, all of whom have passed away, and I am very committed to improving outcomes for patients who are affected now and to hopefully relieving them the anxiety and stress that we have been through as a family.
Raising awareness is absolutely key with a rare disease. People have probably never heard of it before, and the impact that it has on families is so great that you feel very isolated. So if people have heard of it, if there are other people you can talk to, then it makes a really big difference to the way a family might be able to manage within the terms of this diagnosis.
There is huge value to be gained from an early diagnosis. I speak because my son was diagnosed early, and so he has had access from a very early age to supportive treatments. We hope this will slow progression of the disease. It's also meant that we were able to make informed decisions about our family size. He's had access to allied services, physio, speech therapy. He has a classroom assistant in school where he's very happy, and all of those things wouldn't have been possible without a named diagnosis.
The value of early diagnosis for patients who are affected by Niemann-Pick type C is that they will have access to timely care and support and also therapeutic options. This is vitally important for families, not just to achieve an early diagnosis, but to actually get a name for their condition, which means that they can access other services that will help to improve their daily quality of life.
The International Niemann-Pick Disease Alliance are leading this campaign. The International Niemann-Pick Disease Alliance, is the INPDA, is basically a network of patient support groups who are working with families with Niemann-Pick disease around the world.
The value of the campaign is it will enable healthcare professionals to recognise the signs and symptoms of Niemann-Pick type C and also provide them with clear pathways to diagnosis and support services for those families, which will greatly improve outcomes for families and also give them the ability to access local support.
We've got a great team of physicians who are absolute specialists in Niemann-Pick type C disease who can help us identify really what the messages need to be and how we can engage healthcare professionals across the world.
In terms of the target audience here, we're not talking about the highly specialised clinics or centres. They clearly know about Niemann-Pick disease. What we're trying to do is raise awareness amongst professionals who might be the first point of contact for a Niemann-Pick patient and their families. So we are looking at the general practitioners, we're looking at paediatric units, we're looking at liver units, ophthalmologists, a range of different specialities who might see a patient maybe very occasionally, but for whom having a few simple, straightforward messages might be able to say, could it be Niemann-Pick disease? You can see that mounting a campaign of awareness raising amongst professionals is quite a challenge, and it was something that all of these patient groups would love to have done, but individually it was too big a challenge in terms of expertise, time and resources. So the INPDA, working collectively, thought this is something that we could actually do as a project. And throughout our membership, and that's countries in different parts of the world, we hear the same stories, even now. you know, of families who have been years of having this unexplained situation and these awful symptoms in some cases without knowing the reason for them. So there's a big job to be done there, so an awareness raising campaign is a fantastic opportunity really for us to try and make a difference for these families.
This campaign is so vital for patients and families because it will enable them to access support and services as quickly as they can. I know that I am a better carer for my son because I understand what his problems are and I know where I can go to access support and therapies. So it's absolutely crucial for patients and their families.